About 8 months ago, I went for a routine kidney stone CT and somebody noticed something in my lung. I was called back in, and within a couple of weeks I was seeing the people here at Basildon. It was biopsied, found out it was malignant melanoma. One of the things that was offered was to have a section to take it out.
Before you come to your appointment, we like to give you a call just to make sure you're aware that you're coming to have this appointment to meet with a surgeon. We don't want that to be a shock to you when you arrive. Your appointment is going to include having some blood tests taken, it's going to include having an ECG, it's going to involve having your observations taken, and it's going to include seeing myself and the consultant surgeon.
Talk to people, don't be frightened to ask questions. I know it's an old adage that people say, write your questions down first, take somebody with you. Immensely important, because you can't take all the information in because it's a shock. If you do think of something, don't worry to ring them up and ask.
We establish the diagnosis first, we discuss with you how much you know, we take you through the surgical option, what we will do, and what's the potential benefit of the surgery, and what is maybe a complication could happen from there and how we can avoid it. So you'll be thoroughly informed about your operation.
He showed me this CT scan and the PET scans that had been done, went through all the pitfalls and anything that could be a problem, and was very, very confident.
At the end of that appointment, you will be given some paperwork that will include relevant telephone numbers. We'll obviously highlight what medications you're currently taking, and we'll inform you when you need to stop them before your surgery at that clinic appointment, and we'll also remind you when we book your surgery.
They wanted to know what medication I was on, which I provided them the information for. Came away with all this stuff that they wanted us to use, the nasal spray and everything. Instructions were clear. Basically followed everything they did step by step.
We will give you a bottle of octenosan and a Bactroban nasal cream. These are to help protect you from wound infection and MRSA.
We were quite amazed how fast it went. Mentally, the way I dealt with it was to do it section by section. Right, we've done this little bit, now we're moving to the next bit, and then we're moving to the next bit. I think that's quite important.
Day before surgery, about 2 o'clock in the afternoon, you'll come to the ward. We're going to start getting you prepared for surgery at this point, so that might include things like shaving and signing consent forms, going through what to expect on the next day. You'll go down to X-ray and have a formal chest X-ray, just to make sure that there's no sign of any fluid building up in your lungs, any signs of infection and things like that, and that's going to be checked on the bloods that we take as well on the day that you come in.
The consent form that we sign together is essentially just a written confirmation of the discussion and the process that's happened from the clinic itself. We also use that document to confirm that this is the right side and the right location that we're going to do the operation as part of the safety checks that we do. But really the decision is always yours and has already started from the clinic itself.
Deep breath when you sign a consent form, because like everything else, it's a bit of a big step. They just spoke very well, and I was quite confident.
Please bring along your own medications. This is because we don't want there to be any delays in you getting your meds. Bring them in their original packaging so that we can see what medications they are, when they expire, and what the dosage is also.
I bought some shirts in that I button down the front, stuff like that, obviously, because you're going to have surgery on your chest. Anything that pulls over your head, if you're having that type of surgery, don't bring it.
We want you to have comfortable non-slip footwear because we want you up and we want you walking as early as possible if that's what you could do before. We advise that you don't bring in lots of expensive valuables, leave them at home if not needed. You can bring your mobile phone and things, and when you go for your surgery, all your valuables will be locked away in a secure room. We do give you a special drink called Preload, and this is just to make sure that your body is well hydrated, has all the nutrition that it needs before the surgery, because you'll nil by mouth from midnight. You're going to have a shower again in your octenosan wash, get your gown on, get your TED stockings on.
Shaved me all around my chest area and stomach and everything, arms. I had something to eat at tea time, and then I didn't have anything else to eat until after the procedure. The stockings were quite tight to get on. The nurse had a very good sort of knick-knack to get it on. Got myself prepared, and then just generally waited.
You'll be met by one of the theatre department team, and they're the ones that are going to take you down to the anaesthetic room for your surgery.
They're very chatty, taking you down, put you at ease. It's obviously a fairly nervous time. First people that came and saw me were the anaesthetist team. They wired me up to everything that needed to be wired up to, chatting to me all the time. We had quite a giggle, really.
And then me as a consultant or the anaesthetic registrar put the couple of cannulas in your body. One is the cannula in the vein, and that is for giving you fluids and medications. Another cannula that goes in the artery, not in the vein, but in the artery. That is just to monitor your blood pressure in real time. We do combined general anesthetic with the local regional anesthesia, and it's much more a qualitative anesthetic management. We just start giving you some oxygen by mask. It's not any gas or any anesthetic gas. And then we start the medications, the anesthetic drugs that goes through that cannula that is in the vein. You just drift very slowly away and you are not aware of what's happening, but very kindly and slowly you fall asleep.
When you put you to sleep, they insert the tube, one goes to the left, one goes to the right, and they block the side that I'm going to operate on and breathe with the other one on the other side.
Our first line approach to lung cancer surgery or thoracic surgery in general would be a keyhole operation. More than 80% of our cases are done through a minimally invasive approach. We have a camera that visualizes the field. That then allows us to introduce other instruments into the chest, and then using those instruments we dissect around the vessels and the airway that's connected to that area of the lung that we're trying to address.
We have got certain special instruments and devices to use during surgery. Two of them are very important devices. One is energy device. It helps you in dissecting the tissues as well as coagulate or burn them so that they don't bleed. That's one. Second, we've got staples. These staples are used for vessels and for lung. That vessel is divided by a stapler, which staples both sides and cuts in between.
We are always there, not only making sure that you are asleep, making sure that all your vital parameters are and remain in range.
We have got a plastic bag specially made to retrieve this cancer. You put your lung in there, close the bag, and bring it out from the same wound.
Technically, for any lung cancer, we should always have a lymph node taken out for two reasons. If one of them has got any cancer in it, that means the stage is increased. In this case, we will likely need a chemotherapy after the operation. If the lymph nodes are negative, there's no cancer there, and the size of the tumor is less than 4 centimeters, then you're very unlikely to have any further treatment afterwards.
Then we leave a drain inside. The drain protects the chest from any air that's leaking from the lung while it's healing, and more often than not will be removed the next day.
So usually after everything has finished, it takes 5 to 10 minutes for you to come completely around, take off the monitoring from the anesthetic machine, put in your bed, and then we are ready to go to the recovery.
You're going to be looked after by myself or one of the other critical care nurses who run recovery. You're going to stay with me probably for an hour or so. Your main pain area will be obviously around the area where you've been operated on, but also you might find that you get a little bit of shoulder pain from the position where you're positioned in the theatre, and also the drain can also cause you to have some shoulder pain. You'll have an oxygen mask on your face, and that's probably only going to be for a short time until I'm happy with your saturation, that you're taking enough oxygen in. And when I'm happy with that, what I'll do is I'll put a smaller oxygen device just in your nostrils to give you a lower level of oxygen.
I came to in the recovery part of the theatre. I was chatting to the two nurses. I just remember telling them I was cold, and them dealing with that. In my case, there was no feeling of being alone. You felt that there was somebody there all the time.
We're going to do a chest x-ray, and that chest x-ray is for the surgeons to look at to make sure that everything's as it should be, that the drain is in the right position, that there's no any excess fluid sitting in the lung that they're concerned about. So that will be done in recovery. The surgeon has to review that x-ray before you're transferred back to Chelmer. When you go up to Chelmer ward, you'll be in a step-down bay. So it won't necessarily be the room where you started off in the morning, because what we want is we want you to go into an area where you're closely monitored overnight. So you'll be in a 4-bedded bay, which is called the step-down bay, and you'll be nursed by one nurse who'll look after 4 of you and keep a close eye on you overnight.
Myself or one of my colleagues will come and see you, we'll assess your chest drain. We feed back a lot of information back to your surgeon as well, just to let them know how you're getting on.
Basically, the first thing they wanted to come around and make sure you're comfortable. And in my case, the only painkillers I needed were paracetamol.
Obviously, the more extensive surgery, we do expect there to potentially be some more pain. Some patients might have what we call a paravertebral block, little catheter coming out of your back, and that's a constant infusion for your pain relief. And this is normally removed when your chest drain comes out also. If not, you might have a little button called PCA, patient controlled analgesia, which you can press, and this might help with your pain also. Some patients' pain's absolutely fine and they just might tolerate tablets. So we have lots and lots of options for you.
The basic pain for me was because I had a keyhole. It was underneath my arm, and it felt like going into my chest towards my lung. There was an option which I didn't need. They've got a button with morphine, I believe, and if you need it, you can use it.
So one of the ward nurses will come and take your chest drain out once ready. What we normally do is do a chest x-ray before we take it out, make sure it all looks safe as well as our assessment.
They took me down for an x-ray first to make sure everything was okay and the chest and everything.
And then we'll go to take the chest drain out. This involves you doing a little bit of deep breathing techniques that we're going to do with you. It involves us cutting the stitch that's holding the drain in place, but very fortunately our surgeons are very kind and they leave a stitch in place for us for when we remove the drain. So there's no extra stitches that have to be put in. It is just a bit of a deep breathing technique. You hold your breath, we pull the drain out. It's a little bit uncomfortable, but it's very quick. And you'll soon find that your pain feels a lot better after the drain's out.
It was just simply a case of deep breath, hold your breath. In my case, it was fairly painless. The person took it out, talking to you all the time. So by the time you were talking and answered the question, I think it had more or less been taken out.
So once we have removed the drain, this is normally a great sign that we're nearly ready to get you home. We'll send you again for another chest x-ray just to make sure that all looks good once that drain has been removed.
The first day after the surgery, you'll still probably have quite a few lines in. You may have a drain in. We may just be going from bed to chair. This depends on the amount of factors as well, your pain and how well you're doing from that point of view.
It felt inside that it was bruised as such. That's the easiest way to explain it. But then regulating your breathing and doing the exercises they said, it gradually brought it round.
One main thing we use for breathing is called the active cycle of breathing technique. And this is something that can be modified to help you in the best way for yourself. But basically it consists of 3 large deep breaths and then a huff and then a cough. You may find sometimes you clear secretions and sometimes you don't, but actually the act of repeating those exercises regularly will help hopefully mobilise those secretions and improve your lung volumes. We will recommend how often you do those exercises, but generally we would say these breathing exercises to do 5 to 10 reps every hour, but we will tailor that to what the patient needs.
They gave me a strange little machine with a ball in it, and it was a case of breathing out and holding the ball up to a certain level, and that gradually improved. They said that was important to keep doing that. And also I went for a walk right the way down the length of the corridors and everything with the physio lady to make sure that I could walk properly.
We want you up and mobile as soon as possible. We want to reduce your risk of getting any clots in your legs that could potentially go to your lungs or your brain. We want to make sure that you reduce your risk of chest infection. So being up, being mobile, doing all your deep breathing exercises are things that are going to help with that. A lot of the pain relief we give you gives you a risk of constipation. Again, getting up, getting mobile is going to help mobilise those bowels. So there are so many benefits to you being up and mobile after your surgery.
They came around and checked me out, make sure blood pressure and everything was okay, all that sort of thing. I had everything I needed, all the information I needed, all the contact numbers, told me the contraindications to look for, not to hesitate to ring if there are any problems or anything like that.
You'll be given a list of information about things to be aware of in terms of your wound care, but if you're having any other trouble, shortness of breath, increase of pain, you're obviously more than welcome to contact us and we can give you advice for this.
You got a contact number of all our team. In any case you need any help, they're here to help you and guide you through what to do next.
Before you go home, there'll have been a range of investigations already done. So you will have had chest x-rays to make sure that your chest is looking okay. We'll also check all your bloods, check your x-rays, and we'll get you assessed by the physio. We need all of those parts to be in place and make sure that you're completely safe before you go home.
I couldn't really do a lot for the first few days, apart from get up and make yourself move around. And then I gradually was able to go outside, went for a walk outside, and you potted. I'm back doing things at home, cutting the grass, gardening, cutting hedges and stuff like that, but it does occasionally tell you, just sit down for a little bit longer than normal.
We normally try to advise you not to drive for the first couple of weeks. We normally advise for you to be seen in your follow-up appointment and discuss this with your surgeon before you start driving. In terms of flying after any sort of lung surgery, we don't normally advise that you fly for 2 months, and that's just because of the air pressure.
You're in safe hands. You've got an amazing team who's looking after you. We're all there to support and guide you through it. There's going to be someone with you all the time. You're not ever going to be on your own.
You need to work with us to get you through the operation and through this lung cancer process. But we're here to help and we're here to support you through that journey.
It worked from the day we walked in to have the first consultation to the day I came back to have my checkup. Everything went smoothly and I can't thank them enough. Fantastic.